there's a condition called familial polyposis coli, which I am going to talk to you about. Familial polyposis coli is a condition where there are multiple projections in the large intestine. They are called polyps, and they are like they are like little fingers that project into it. And how do we diagnose this condition? These patients usually have some bleeding while passing motion, and if that keeps happening again and again, one has to undergo a test called colonoscopy, through which in which we put a tube, a colonoscope with a light at the tip in the colon and check the entire colon where you can find these polyps. Single polyp or a handful of polyps is very common. Where somebody has more than 100 polyps in the entire large intestine, it's called familial polyposis coli. And this condition is genetic and hereditary. This comes from generation to generation, that whenever somebody has this condition diagnosed familial polyposis coli, other siblings, the brothers and sisters, have been investigated, and from talking to the family, one will realize that the father, mother, uncle, somebody had this problem. In addition, somebody would have died also of this problem. The reason is, the familial polyposis coli is a pre-malignant condition. In due course of time, 1 or 2 polyps will become cancerous, and that is the reason why this has to be taken seriously. Actually, these polyps will come by birth, and by the time a child is 7, 8, 10, it will be manifested, and when we do a colonoscopy, you will find it. The 100% of this polyposis coli will become cancerous in some point of time in the patient's life. So, as and when the patient is grown reasonably enough, all the joints are fused and growth is stopped, and that is when we have to decide on removing the entire colon. It is not enough if we just remove 1 or 2 polyps, because you have to remove the entire large intestine. You might wonder that how will a patient live if the large intestine is not there? Patient can very well live even if the entire large intestine is taken out, where we make some sort of a pouch like thing with the remaining small intestine, and we stitch it to the rectum area. So, patient will pass motion normally. So, this condition called familial polyposis coli is an important genetic condition which runs in the families, and once diagnosed, this has to be treated. That the patient has to be very serially followed up. Entire family members have to be checked, and if found to have polyposis coli at some point of time, we have to remove the entire large intestine, because it's not just possible to remove the polyps alone. And total proctocolectomy is what is done, and it's a major operation. And after this operation, one can have the continuity of motion through normal route by using small intestine instead of large intestine. Thank you.